7 ways sleep apnea can be harmful to your health. Sleep apnea can put you at risk for a variety of health issues, including heart disease, high blood pressure, diabetes, and depression. You probably already know how important it is to get enough sleep, but if you have obstructive sleep apnea, you can sleep for more than 8 hours and yet not feel refreshed. According to the National Sleep Foundation, obstructive sleep apnea is a sleep disease in which the muscles in the back of the throat fail to keep the airway open during sleep, resulting in frequent pauses in breathing lasting at least 10 seconds (NSF). When this happens, your brain temporarily wakes you up to reopen your airway, and this recurring pattern of sleep interruption, which can happen up to 30 times per hour, can impair your capacity to receive the deep, restful sleep you require. Sleep apnea has been related to a variety of health issues, including an increased risk of high blood pressure, heart attack, stroke, obesity, diabetes, and even glaucoma, according to the National Heart, Lung, and Blood Institute (NHLBI). Quality sleep, not simply quantity, is what is meant by enough sleep. Someone may get 7 to 8 hours of sleep but still feel exhausted because they aren't sleeping deeply. To rejuvenate, we all require deep sleep. Here are some ways sleep apnea can harm your health. 1. Sleep apnea can be harmful to the health of your heart. Heart disorders such as irregular pulse, heart failure, and heart attacks have been linked to sleep apnea. According to the National Sleep Foundation, if you have sleep apnea, you stop breathing while sleeping, which causes your heart rate to plummet. When your body wakes you up to breathe again, your heart rate rises, raising your blood pressure. Sleep apnea also reduces the amount of oxygen in your blood, decreasing the amount of oxygen that reaches your important organs. To work properly, the heart, like your other organs, need oxygen. Reduced oxygen levels in the blood also raise the levels of inflammatory substances in the blood, which can harm the heart and blood vessels. While eating a heart-healthy diet and exercising frequently are crucial, treating sleep apnea and getting enough sleep can also help lower your risk of heart disease. 2. Sleep apnea can put you at a risk of stroke. Although it's unknown whether a stroke or sleep apnea occurs first, experts warn that one could lead to the other. For example, a review of research published in the Journal of Thoracic Disease in December 2018 indicated that sleep-disordered breathing, such as sleep apnea, appears to increase stroke risk, and sleep-disordered breathing is a prevalent problem among stroke survivors. Obesity, hypertension, and diabetes are all major risk factors for both sleep apnea and stroke, according to the study. Atrial fibrillation, irregular heartbeat, coronary artery disease, congestive heart failure, and diabetes were all found to be closely linked to sleep apnea, all of which are risk factors for stroke. 3. Obesity is a possible side effect of sleep apnea. According to the National Sleep Foundation, while not everyone who is overweight has sleep apnea, obese people are more likely to be diagnosed with the illness. You're also at danger of gaining weight if you have sleep apnea. What's the connection between obesity and sleep apnea? Fat can collect in the neck area as you gain weight, obstructing your breathing and contributing to sleep apnea. Plus, if you don't get enough sleep, your body doesn't create enough of the appetite-regulating hormone leptin, which helps you feel full. He argues that the lower the levels of leptin, the more difficult it is to manage appetite and lose weight. Sleep apnea can also contribute to increased daytime sleepiness, which can lead to a decrease in physical activity and weight gain. According to the National Sleep Foundation, decreasing 10% of your body weight can reduce or even eliminate sleep apnea. 4. Obstructive sleep apnea increases the danger of high blood pressure. When you stop breathing and your oxygen levels drop, your brain sends a signal to your body to increase adrenaline levels, causing the heart to beat faster and blood vessels to constrict. These changes occur in an attempt to boost the quantity of oxygen available to the heart and brain, but they also cause blood pressure to rise intermittently. According to the NSF, these changes can increase your risk of hypertension and put a lot of stress on your cardiovascular system. If you have sleep apnea and high blood pressure, it's critical to speak with your doctor about getting your sleep apnea addressed. The treatment of sleep apnea is an important element of hypertension management. 5. Sleep apnea increases your chances of developing type 2 diabetes. According to the National Sleep Foundation, sleep apnea impairs the body's capacity to manage and metabolize glucose, raising your risk of insulin resistance and type 2 diabetes. This is due to the fact that sleep apnea reduces the amount of time you spend in deep sleep, which is regarded to be a crucial mechanism in the body for glucose management. It's also true that if you have diabetes, you're more prone to suffer from sleep apnea. According to the American Academy of Sleep Medicine, up to 7 out of 10 patients with type 2 diabetes also have obstructive sleep apnea, and the more severe their symptoms are, the more likely their glucose levels will be out of control. 6. Obstructive sleep apnea increases the risk of metabolic syndrome. Sleep apnea and metabolic syndrome are linked, according to research, including a meta-analysis of 39 studies published in April 2018 in the World Journal of Diabetes. Metabolic syndrome is the name for a group of risk factors that increase your risk of heart disease, diabetes, stroke, and other health problems. Metabolic syndrome is defined as having 3 of the following risk factors, according to the NHLBI: blood pressure that is too high, cholesterol levels are abnormal, blood sugar levels are high, increased waist size or excess abdominal fat in the stomach area, high blood sugar levels after a fast, a test result from a blood sugar test done after not having eaten anything for at least 8 hours. 7. Sleep apnea might have a negative impact on your brain. Sleep apnea can affect your cognitive performance as well as your physical health. Sleep apnea has been linked to cognitive impairments like decreased concentration and attention, reduced motor abilities, and even poor memory, according to the NHLBI. For example, a study published in the Journal of the International Neuropsychological Society in March 2019 indicated that those with untreated sleep apnea had more trouble recalling precise facts about their life than those who did not. Aside from that, sleep apnea can literally injure your head. People with sleep apnea can wake up with a headache because sleep apnea reduces the quantity of oxygen that gets to their brain. It's critical to get treated for sleep apnea as soon as possible if you suspect you have it. If you've been diagnosed with sleep apnea but are still experiencing symptoms like excessive daytime sleepiness, talk to your doctor about trying a different treatment. Sleep apnea can be cured and the associated health risks mitigated. Some people may be hesitant to see a doctor and have a sleep study performed because they've heard that you have to go to a sleep center and be hooked up to monitors and machines. But the diagnosing procedure is a lot simpler now than it was decades ago.